Hi there, Duncan here, physiotherapist and owner of Life is Movement, here with another exercise video demonstration. I make these videos for my patients here at the clinic. However, if you're not a patient and you find any of these exercises valuable, of course, you're welcome to take them and run with them. Just please make sure you do so safely. So, as you can see, I'm in a slightly different position today. I'm upstairs in my treatment room rather than downstairs in my gym because I need my treatment couch to best demonstrate this exercise for you. So this is a nice, gentle, passive way of stretching the hip. The hip is a sort of weird term because the way physiotherapists use it seems to be quite different to the way we tend to talk about the hip, just in sort of common discussion. Sometimes people talk about the hip and what they're really talking about is the sort of groin. Sometimes people talk about the hip and what they're talking about is the glute. Sometimes people talk about the hip and what they're really talking about is the sort of lower back. And sometimes people talk about the hip and they're talking about the hip joint itself. When I talk about the hip, I'm really talking about this whole chunk here, which encompasses the hip joint itself, the ball and socket joint, but then also all the muscles that work upon that joint. So the hip flexor at the front, the big gluteal muscles at the side and back, even the hamstring, the quad to a certain extent. So when I say to stretch out the hip, I mean that entire complex. So this is what I call the passive hip stretch 3 ways, because we're going to stretch the hip into flexion, we're going to stretch it into extension, and we're going to stretch it into external rotation. And this is particularly valuable for people who've had any sort of gluteal tendinopathy or hip issue, but more active stretching, things like doing yoga classes, pigeon poses, things like that, are still a little bit too intense. So this is a nice passive way of doing it. So I'm going to lie on my back. And so here I'm stretching my right hip. Just make sure I don't ruin the audio. So the first thing I'm going to do is stretch into hip flexion. Hip flexion is bringing the knee up towards the chest. So all I'm going to do is bring my knee towards my chest, and I'm already getting a nice stretch sort of down into the gluteal muscles, even a little bit into the hamstring. And actually, for a lot of people, if you have tight hip flexors, I'm also getting a nice stretch into the front of the other leg. So if I were to stretch this leg, my left leg, as you can see, I'm getting a little bit of a stretch into my hip flexor on my right. So that's a nice passive way of doing it. Some people like to pull the knee towards the opposite chest, so left knee to right chest. That can also feel nice too. But the really important thing with this nice passive stretch is all you're doing is gently bringing the knee towards the chest. We're not sort of trying to yank things or force things. You're doing the stretch in somewhat in an active position, but it's nice and gentle, nice and passive. The second stretch is into external rotation, which is a funny movement, which basically means bringing the knee out to the side and the foot sort of in. So we're externally rotating at the hip. And so all we do is we place, here I'm placing my right ankle just above my left knee and allowing that right knee to sort of sink down. Now, for some people, they find they are extremely tight into external rotation. I'm not too bad. So with this one, don't force it, don't push the knee down or anything like that. Just let gravity do its thing. Like if you get stuck here because your hips are really tight, just chill there, let gravity do its thing, and you'll eventually sink lower and lower into that position. So that's the second way, that's into external rotation. And the final one is into hip extension. So to do this one, I'm going to move slightly further this way off the couch. And all I'm going to do is let my leg sort of hang a little bit down off the couch, off the treatment bench here. And I can already feel like a nice little opening up and stretch into the front of the leg. Again, I'm stretching the hip flexors here because obviously if I'm stretching into extension, I'm stretching the flexors of the hip. People get really tight in this position. So a lot of people find actually sometimes even just dropping off slightly can cause quite a deep stretch. So be really careful with this one, just nice and slowly, and allow that, once again, like with external rotation, allow that that will allow gravity to do its thing and stretch into external rotation. That's it. So that's the hip stretch. 3 ways. I give this to patients as an early stage rehab, sort of nice gentle stretch before we move into more sort of intensive, more active, more dynamic stretches for issues, any issues that surround the hip itself. I hope you found that useful.